April is Cerebral Palsy Awareness Month. Today we are talking about something that plays a major role in child's long-term health, preterm birth. Joining us now with information is Dr. Teresa Baker from Texas Tech Physicians OBGYN. Dr. Baker, thanks for coming in today.
You're welcome.
And can you tell us a little bit more about preterm birth and why it is such a concern?
So cerebral palsy is hard to understand for a lot of people, but basically it's a neurologic event that happens in a fragile newborn's little brain that causes a neurologic sequelae that can last lifetimes. And it's a really wide range of outcomes. It can go from they never get out of the wheelchair, they're not able to communicate, to they go to medical school and live very normal lives. But basically, the newborns that are most at risk are those that are born preterm, meaning anybody less than 37 weeks.
Okay.
So those preterm babies are the ones that are really at risk of their little brains being damaged for life.
Yes, and tell us a little bit more about this awareness month of April.
So, you know, what we're really pushing is just how preterm birth is something that is very hard to predict. The leading factor in preterm birth is previous preterm birth. So if you've had a preterm birth in the past, you're at risk of it again. Okay. Another big risk factor is what we would call iatrogenic factors. So things that we're going to have to put you into labor because we're weighing the risk and benefits to the mother and the child. And those things are usually things that we can improve on, like high blood pressure and diabetes.
Okay.
And people that smoke. If we can get them to stop smoking, we can prolong those pregnancies, and those babies will do better in the long term. So there's a lot of focus on getting early, good, consistent prenatal care.
Yes.
So that any modifiable risk factor, anything we can do to improve the outcome, we have a chance at. If we don't meet a woman until our third trimester, there's just not much we can do. But if we meet them early, let's say in the first trimester, there's a lot of things, getting her blood pressure under control, starting her own baby aspirin, you know, making sure that we do everything we can to help her stop smoking, or any kind of change any medicines that are going to, in the long run, benefit us or keep the pregnancy going longer. We're going to have a better outcome.
And with babies that end up with CP, do they make it to adulthood, or what's that
yes.
like?
The outcomes are so variable, and that's a hard thing for parents because they see this newborn baby, and you know, I have to say to them, I don't know what the end result is going to be. And it can be because of low oxygen, it can be because of a brain bleed or a blood clot. There's lots of reasons, but we know one of the biggest reasons is preterm birth, and that fragile little circle of Willis in their head is just at risk of a lot of things. So anything we can do to protect those new babies, the outcomes, even if there is an event at or around time of birth, even if there is an event, we're going to have a better chance of having a good long-term outcome.
Well, Dr. Baker, thank you for dropping this knowledge onto us, and it is so important. It's an important topic, especially this month for the Awareness Month of April. Thank you so much.
You're welcome.
And stay with us. We have more Studio 4 after the break.